Hi, I'm Michael Juceum, and this is Cindy Juceum, and together we operate Right at Home, private duty home health agency. And the fact of the matter is that a huge proportion of the clients that we provide care to have dementia at some level. And one of the things that we wanted to talk about a little bit is with the holidays approaching, many folks are going to come down and visit their parents who are living here in Florida. And they're going to be confronted with people who seem different than the parents they knew and loved in the past. And so what we thought we'd talk a little bit about are some of the signs to be aware of and sensitive to that might indicate that your parents need some help. Cindy, one of the first things that I know that we've talked about in the past is that diet can change. People aren't eating the right way. What do you look for in the house?
You want to look for, particularly if there's a lot of overdate or spoiled food in the refrigerator, even in the cabinets. Look in the trash. What are they really eating? Is it all candy wrappers and ice cream cartons? That type of thing. But diet tends to really suffer with people with dementia. They may no longer be able to remember how to make a meal for themselves.
And one of the things that you may find is that your parents, to use a fairly strong word, may have been lying to you. You come down for a visit, you haven't seen your parents in several months, and you suddenly find that the parents who told you that they were okay really aren't. And whether they were accepting of things that have changed in them, or they may not even have been aware of the changes that were occurring, but those changes take place. Things, for example, maybe there's been significant change in their weight, either weight gain or weight loss. That is another indication that their diets are either inadequate or inappropriate. Cindy, talk also about appearance. What are some of the things that might indicate from their appearance that things have changed?
They're wearing dirty clothes. They're wearing food-stained clothes. Their hair looks dirty. It hasn't been combed. Mom who never left the house without makeup now, is maybe not even washing her face anymore. There may be changes with continency. So are they addressing that issue? Are you finding incontinent products that are being reused multiple times?
Another basic thing is, how's the house smell? Is the house dirty? You know how your parents lived all your life. Do they look like they're living the same way? Another thing that can be very problematic is that parents are still driving when maybe they shouldn't be. What are the things you should look for when that might be an issue?
Check out the car. Is it dinged up and scratched up? What shape are the tires in? They may not admit to it, but maybe a neighbor or someone knows that they're getting lost when they're trying to drive. They can't find their way to places that they went to for years, maybe.
Along the same lines, if they have a garage, check out the sides of the garage.
Yes.
Are there paint scrapes on the garage? Because all of those things are going to be indications that either their vision is changing, their depth perception is changing, or in fact there are other problems that are inhibiting them from being appropriate drivers. There are some other things I also think when you get to the house that you can look at. Look at the mail. Is it piling up? Are there dunning notices saying that there are bills that haven't been paid in a timely fashion? All those are going to be indications that something has changed. And then another thing that we see a lot is medication issues. Talk a little bit about those.
Often people aren't taking their medications appropriately. Either they're taking them too often or they're not taking them enough or at all. You might want to check their medication bottles. Are these current prescriptions or did they expire 2 years ago? Medication errors are the number one reason why seniors go to the emergency room. But But if you don't remember that you have a new diagnosis and a new medication, you may not be getting that prescription filled, and therefore you aren't taking the medication.
There are other things too. You actually, besides their parents' clothes, you have to look at their physical condition. Are there bruises that may not have been healed? Are there skin tears or other things that about their physical well-being that just don't look like they're being addressed? Because, for example, if you do see a recent bruise, that might be an indication of a fall. So when you're in the home, especially if you haven't been there for a long time, you really need to look and examine things with a critical, objective eye. And that's not always easy because we see our parents, we want to see our parents as the people they were when we were growing up. But that's often not the case anymore.
When you go into your parents' home and it's an obstacle course, there's old newspapers, old magazines stacked everywhere, clothes are scattered on the floor, and it doesn't look like the home that you were used to them living in, people will sometimes say, oh, it's okay, they're getting older and this is typical behavior. But if it's not typical for your parent, it's not typical for an aging parent.
Last thing we should talk about a little bit, one of the problems that comes with dementia is isolation. And so ask your parents, are they going out? Are they seeing friends? Are friends coming over? Or are they socializing less and less? Because if they are socializing less, it may be because they are either embarrassed by things that they're no longer capable of doing, or because some of their friends are no longer comfortable with what they see when they come over. So another thing is, if you don't feel that you're getting perhaps a complete story from your parents, talk to their friends, ask what they're seeing. All of these are things that you can do to help you determine whether your parents really are in need of more care than they're getting.